Good afternoon, dear patients. Today we will discuss a clinical case of thrush on the penis after oral sex. A man came to us who had sexual relations only with his wife, including both vaginal and oral sex. Basically, he had, as shown in the picture, a rather intense coating both on the glans and on the foreskin. The coating was white, kind of crumbly in appearance. Accordingly, tests were taken both for sexually transmitted infections and a culture of the coating for bacteria and fungi, as well as a PCR test for 8 types of Candida from the surface of this coating and from inside the urethra. As a result, the fungus Candida albicans was detected, which is in fact the cause of most cases of thrush on the penis. The man was started on a course of standard treatment, which included oral medication, injections, rinsing, and ointment therapy for 10 days. Accordingly, medications were used, including those selected based on the sensitivity of the Candida to specific drugs. Sensitivity to ketoconazole was detected, so it was prescribed. Sensitivity to fluconazole was also detected, so these 2 drugs were prescribed as ointments and injections. Longidaza, ointments, rinses, and so on were also prescribed. Accordingly, it was recommended that, as his only partner, his wife should also be examined. The wife did in fact undergo a proper examination. A PCR test for 8 types of Candida was done from the vaginal sample, and a culture for Candida was also performed. Everything came back negative. Well, in general, they didn't want to treat the wife, but I also insisted that samples be taken from her mouth as well. And so, in her mouth, they found Candida albicans, both in the culture and in the PCR test, which prompted us to start comprehensive, full treatment for the wife as well. So, accordingly, I'd like to point out that many partners don't check the oral cavity if such contacts take place, and in today's world, almost all couples have unprotected oral contacts. They also don't check the anus when these contacts occur. Accordingly, these areas can be sources of, in our case, thrush. Therefore, if candidiasis does occur and is truly confirmed in the lab, not just diagnosed by many doctors by eye whenever there's any redness of the glands, then a thorough examination of the sexual partner is recommended, which is what was done in this case. In addition, both partners should receive full treatment, followed by follow-up tests. Let me remind you, follow-up tests are taken no earlier than 2 to 3 weeks after recovery. So, accordingly, this patient, this married couple, both partners underwent comprehensive treatment, and as a result, both tests, from the woman's mouth, the wife, and from the man's penis, were all negative. Only in this case is it possible to achieve a high-quality long-term cure. Unfortunately, many doctors also believe that Candida should always be present. However, Candida should not be present in significant concentrations as detected by tests, because otherwise this leads to conditions such as candidal balanopostitis, which unfortunately is often treated by doctors only with ointments. But that's a topic for a completely different video.